you to the Cultural Experience.
Thank you
for being here.
Of course.
Very safe space for us to be able to talk about our experiences, and our big thing is how can we create change, right?
Awesome.
So that those that come behind us don't have to experience things that we've experienced.
For sure.
So if you want to introduce yourself and kind of talk a little bit about your contribution to the healthcare system.
Okay. So my name is Deana Weaver. I am a certified nurse midwife. I have been a registered nurse for 17 years now.
Okay.
Been a nurse midwife for, been about 9, almost 10 months that I've been a nurse midwife.
Okay.
Currently practicing in a gynecology office, in a gynecology setting. So doing lots of women's health things, hormone replacement therapy, weight loss stuff, all kinds of things. Want to definitely kind of advance back over into the OB setting as well, but currently doing gynecology stuff.
Okay.
But yeah, big passion for all things women's health.
Yeah. Okay. Now what led you there?
So my journey to women's health was basically, and it's funny because when I kind of developed, so I always had an interest in women's health. Like even when I was in high school, originally I was pre-med, right? Like when I decided I wanted to go to college, I was like, okay, I want to be some type of physician.
Okay.
Decided to switch over into nursing, but still had an interest kind of for women's health, but kind of did some other things on my nursing journey, but then was working in insurance case management, started working with the Medicaid population, and then got transitioned over to OB case management with the Medicaid population, and really started to learn about kind of the state of maternal health in this country, and how jacked up it is for all women, but especially for women of color, and was like, holy crap, this is a hot mess. And not only from a statistic standpoint of like knowing the numbers, right, that Black women were like 2 to 3 times more likely to die in childbirth or to die from like postpartum or pregnancy complications, and that infant mortality, Black babies are more likely to die as well.
Yeah.
But even just some of the things that I was seeing that Black women were less likely to breastfeed, just seeing some of the patients that I was seeing and how lost so many of the women that look like us were. And I just really wanted to make a difference. And it was so crazy because I was like, I always said that I was never going back to school for a nursing degree. I said that if I ever went back to school, because at the time I had my associate's degree. And I said if I ever went back to school, that it was going to be for like counseling or something like that. I had no desire whatsoever to go back for a nursing degree.
Won't God see you?
Right. And so I was like, I'll just become a doula. That way, I can kind of make a difference in the maternal health world. And was like, yeah, this isn't going to cut it. Like, this isn't really going to do what I needed to do.
Right.
And so that kind of led me back on my journey to get my bachelor's and then my master's and to become a midwife.
Yeah. Congratulations on that.
Thank you.
Yes, congratulations, because we need you.
Thank you. Yeah.
And when I talk to nurses that have advanced in their careers, it's always because of the community, right? A lot of times we know that they lack the understanding, and then we know that our counterparts don't really take the time to educate them the way that we need to be educated, or on the level to at least just make you at least be able to understand what it is that I'm saying, without using those big words and then kind of getting you out the door, and here it is, you out there and you lost all over again. Right. You know what I mean? But also trust, right? A lot of us, because I did the maternity thing with you guys, just, for a short period of time, and I absolutely loved it, but, I kind of just moved around. Right. But the one thing that's consistent in nursing, no matter what field it is, the trust that we have, our people have for the doctors and the other nurses that are taking care of us, we consistently don't. We lack the trust. Yes. Because we are continuously shown that we don't really matter the same. So that's one of my biggest things, because I same thing. I'm like, all right, I'm done with it. Nursing school will humble you. You know what I mean?
Yes.
Nursing school will truly humble you, but the thing about it is for us to have to work as hard as we do, and then moving over to the way that we're treated in the in the in the workplace.
Yes.
You know, so let's talk about that. So some of your experiences with being African American, being a woman, being in a position of higher power. You know what I mean? What is that like for you?
So thankfully, so far, as a midwife, I have had good experiences.
Okay.
I've had good experiences. My current employer is actually a Black physician.
Okay.
So made a huge difference, right?
Yeah.
Like, of course, he couldn't necessarily advertise, you know, I'm looking for a Black advanced practice provider. However, knowing his patient population and, you know, knowing that because he's a Black physician and he had basically taken a promotion, and so knowing his population was a large percentage was Black.
Right.
He's like, I know what my patients are looking for. And so, yeah, I definitely feel like that's made a huge difference.
Yeah.
So I've had good experiences in that regard.
Good.
Now, in my clinical training, not always the best experience, but, you know, when you're in school, you have to do what you have to do to kind of, you know, get through it.
Yeah.
But definitely some uncomfortable, you know, episodes, or just kind of some, I wonder if this would have gone differently if I looked differently.
Let's talk about that, because so I have 4 degrees, and you know my nursing degree is my master's degree, but regardless, all of the programs, I take that back, minus my associates, my bachelor's and my master's, all of the clinicals that I had, I was either the only one or there was always maybe one that kind of looked like me. So you know, that's always a different thing, because it's like you have to be a certain way in order to fit in, I guess, or whatever. But I don't. It's just it's extremely heavy, because we can't really explain to them what we're experiencing, because they don't understand.
Right.
You know, so they don't experience the experiences that we experience. Therefore, we're unaffected by it.
Right.
You know what I mean? So you know, we all know it. Like, that's the thing. We know what we see, but then when we are looking for positions, you know, we kind of don't have a choice. We have to conform to be a certain way in order to simply be. Do you know what I mean? So, you know, but some of the experiences that you might have experienced just as an African American nurse, like what has that been like for you?
So I feel like, for the most part, for me, especially like from being when I did insurance case management to even like being at the bedside, I feel like it was, being an African American nurse, it was rewarding, because you could literally see the relief on my patients' faces when they saw that I looked like them.
Yeah.
You know, and so, like, especially, it would be so funny, because like when I was doing case management, I was field-based, and so, you know, they didn't know what to expect. They would hear my voice on the phone, they would see my name, but they didn't know what to expect. So when they would open the door, it would just kind of be like, oh, okay,
Yeah, right. But the thing about it is even just with the response, like even without them saying it, you know what they mean.
Yes.
You know what I mean? Like, I know exactly what you mean. Like, now it's like, I feel safe now.
Yes.
You know?
Yes, absolutely.
Yeah.
Well, and even, but I will say, on the flip side of that, there have been times where I feel like, as a midwife, where initially, if I have like a Caucasian patient and they're just like, you can kind of, they seem kind of guarded or whatever initially, you know, and so, but I'm going to be myself regardless. You do whatever you do, but I'm still going to be Deana no matter what, and I'm going to show the love of God no matter what.
Absolutely.
Because I don't feel like having to repent later if I treated you wrong.
Right.
So.
But you know what? Even with that though, like, because for me, we know we get that, so we know how like a Caucasian patient may look at us, but then when they hear your voice, they hear how you talk, they hear what those credentials are like. It's like, oh, you are qualified, and you're not the maid, or you're not the janitor, or you're not the, and there's nothing wrong with any of those positions, because if those people didn't show up, you couldn't be in the clean room. right?
Absolutely.
You know, so that's why even in my position, I always made sure that I would help the housekeepers. Come here, let me help you.
Absolutely.
You know what I mean?
Absolutely.
Or the PCAs. Look, I got you. Don't even worry about
Absolutely.
it. Right? Because I used to do that work too. And it takes everybody's job to make all of this go around, right?
Mm-hmm.
But then I've had African American housekeepers who say, you know, the white nurses would just treat me like I'm nothing. You know, and I would have to explain to them, like, I'm not them.
Right.
I will help you.
Absolutely.
Your job, you're very important, because if these rooms were clean, they couldn't take care of patients. You know what I mean? I need you. So what can I do for you?
Right.
You know what I mean? And it's like, if everybody just kind of like had that attitude, it would just make coming to work so much more pleasure.
Mm-hmm.
It would make it so much more pleasure. But with these babies, because I find it now with the way that the healthcare system is and knowing how I feel and the change that's needed, anytime I see an African American female, and not just that, because this is an inclusive thing. So I just like to make that clear for people to understand that this is inclusion, but African Americans, a lot of times, we experience the worst, shall I say. So when I see an African American female who is pregnant, I automatically start praying for her. You know what I mean? Because I'm like, I just don't want you to be the statistic. Do you know what I'm saying?
Oh, absolutely.
Yeah, so we have to, and I, even though that's not really my specialty, I want to be able to get involved, and that's why I'm doing this too. I'm like, I want to be able to create an environment for them.
Yes.
The lactation aspect, right? I understand the importance of that, you know, that passive immunity and all that, right? Because the babies need it, right? It does help with the babies not get sick. You know, so kind of talk a little bit about that, because I want all females, but to the African American females who will be watching this, you know, the importance of health, right? Because for somebody like you, they gonna listen to you.
Oh, absolutely.
Yeah, so what you want them to know?
So, well, first of all, it's so important to, even before you get pregnant, it's important to be your healthiest self before you even get pregnant. So really kind of that preconception, that's the fancy term for it, preconception care, making sure that you're your healthiest self before you even get pregnant, right? So if you're, you know, if you're overweight, you're at increased risk for preeclampsia, you're at increased risk for gestational diabetes, you're at increased risk for postpartum hemorrhage, you know, all of these complications. So if you can be your healthiest self going into your pregnancy, that's ideal. Even definitely, and I encourage all women to take some type of childbirth education, because it's important to be well informed and not just like an actual childbirth education class, not watching TikToks, because there's so much information. It is really misinformation. It just really grinds my gears sometimes. Everybody is an expert. Everybody is an expert. So, you know, getting legitimate information, but also having a doula and finding a provider that you trust. Because here's the thing. Yes, everybody wants to have this, you know, natural water birth where I just go into labor naturally and, you know, I give birth at home in a pool, and, you know, a lot of women want to have those births, and that may be, you may be able to have that for a lot of women, but there are sometimes, and yes, there are way too many physicians that rush into C-sections and that pressure patients into inductions. But sometimes an induction is needed. And sometimes a C-section is needed. And so it's really important to have a provider that you trust, right? A provider that you feel like, you know, if you're my provider and you're telling me, you know, Deana, I know this is what we wanted. However, things have shifted and we got to go a different route. I know that you have my best interest at heart.
Absolutely.
And I don't feel like, she ain't for the right thing. You know what I mean?
Absolutely.
So really trusting, having a provider that you trust, so that when they have to have those hard conversations, you're able to listen, because you know that they're going to lead you in the right direction.
Now, but one of the biggest things is a lot of people can't find providers that they trust. How do you get there?
So, word of mouth. Word of mouth is a good one. So seeking out, you know, okay, your cousin just had a baby last year. What does she think about her provider? or, you know, asking other people that you know. Word of mouth is really, really big. You know, if you have a provider that you feel like you can't trust, okay, maybe you need to think about switching.
Yeah. Let me say Black providers, because I've had a lot of
there's not enough of us.
That's the point that I'm getting at.
There's
you know what
not
I mean?
enough of us.
So a lot of our people have a hard time even going to the hospital, right? Because they don't trust. I've had this conversation way too many times to know that, you know, it's like, or when they're in the hospital, they're like, where are we? Where we at? You know, and like you said, that feeling of, you know, I feel safe with you. And I always make sure that my patients get my experience. So I'll be like, you gonna get the Brittany experience, you know what I mean? Like, I'm gonna give you the personality so that you feel comfortable and calm. Because nobody wants to be here.
Yes.
You know what I mean? Like, I love taking care of patients passionately. But I also want to be a mom.
Right.
You know, I want to be a wife. So it's like, if I'm gonna give you my time, we're gonna have a good time.
Absolutely.
You know what I mean?
Yeah.
But I'm also gonna make sure that you're educated and that you understand, because education for me is like one of the biggest things. Yes. Like, I'm not gonna come here and be like, oh, okay, and I'm looking at your blood pressure, you like 200 over 150, and it's just like, are you feeling okay? Okay, cool, I'm gonna give you these pills, you know what I mean? And then, like, no, I'm like, I'm gonna get on your nerves.
Right.
You know what I mean? I'm having this conversation, I'm gonna get on your nerves, and then when I come back, I need for you to repeat what it is that I said to you so that I know that you understand. Sometimes you gotta treat them like you're your kids. You know what I mean? Because it's like, this is what I said, alright, now let's take a look at this.
Right.
Okay.
Right.
You know what I mean? So that's what I'm saying. That's the kind of experience that I like for my patients to have with me, because you do understand that I do have your best interest at heart. Absolutely. I didn't waste all the time in school just to waste all the time in school. You know what I mean?
That work.
So I also feel like that, you know, as far as even moving up the chain, you know, I didn't waste this much time in school to waste as much time in school. I'm very educated, right? I know how to speak, but also, you know, we also have been, just because you're a nurse or a doctor or, you know, the head of whatever, like, you still have mental health. You know, you have to be able to protect your own self. So it's like, you know, we need environments that create that. The nurse practitioner, when y'all see this video of the last nurse practitioner, because it was so funny with her, because she went back and forth, you know, with a time that she was having being an African American. See, yours is different because, you know, you have a Black provider that's over you, where she doesn't have that. You know, her challenges are, I'm being challenged because I'm African American, right? Very, very difficult. So the mental gymnastics that you have to go through to remain professional, right? And I still have to do my job because everything falls on me if it's, you know what I mean? Right, so it's like we all have different challenges that we have to do, but how do you do it? Like, what is in place for your mental, because you can't be yourself, right? You have to learn how to code switch in order to maintain a job, right? Even though my natural self should be maintaining my job anyways, because I'm just that good. Not to be cocky, but I know my capabilities.
Absolutely.
Okay, I know my capabilities, but being around them, we know how they look at us. We know how they talk to us. So it's like, why are you even here? You know, like I always say, you should treat your staff like they ask that, because we show up to do what you don't do. You know what I mean? So, you know, it's just these challenges. So, like, what can we do as far as the Black maternal health? Like, what would you recommend as far as the people being able to come together so that we can teach each other? Because instead of going back and forth, like, I look at you and I admire you. As an African American woman, kudos to you. You know what I mean? But we have to be able to look at one another and be like, I am not your enemy. No. You know what I mean? I'm not your enemy. Sis, I encourage you to do more because you can. Because you are. You know what I mean? Like, it's enough room for all of us, because we need us people. You know what I mean? So what kind of things do you feel that we can do to just be encouraging to one another so that, you know, we can lift each other up? Because I also feel like, you know, we as the African Americans, we would tear each other down faster than we would lift each other up. When them, even if they tear each other down, they're going to make sure that they come up with what they do. Right.
Well, I think it's really important, like, just that support piece, like, kind of what you just mentioned. So, like, for example, I'm a member of a organization. The acronym is like AAEAPN.
I got the AA part.
Sorry if y'all watch this video. I can never remember the acronym, but it's like
you're involved.
Advanced Association African American Providers of Excellence. basically a group of African American nurse practitioners.
Okay.
Students are also, allowed to be a part of, and we have like monthly gatherings.
Okay.
There are different, typically for each monthly gathering, like there will be an organization that sponsors it, like at a restaurant or whatever, they'll do a presentation.
Okay.
Whether it's like a pharmaceutical company or like a lab company, like I think LabCorp did one of them.
Okay.
And so just that as an example, so like support system or whatever, right? Because who better to know exactly the challenges that you face than people that are right there in the trenches with you. Mm-hmm. And so I just really feel like, definitely supporting one another as far as like, and then just, I don't know, I think just supporting each other is just really, really a big one.
So I was reading an article, about different diseases. Mm-hmm. And one of the things that the article was it was talking about breast cancer in women, right? Mm-hmm. So, the importance of getting your mammogram, right. And, what the ages are, mm-hmm. and, kind of what that looks like. Mm-hmm. And in this article, it said that Caucasian women, it listed Caucasian women, Black women, Asian women, and like Native Americans. And Caucasian women are diagnosed at a higher rate than African American women. Mm-hmm. But African American women die mm-hmm. at a much higher rate. Mm-hmm. And the thing that I think the most of myself that is consistent in the healthcare system is the way we get treated. Mm-hmm. You know what I mean? We don't get the same treatment. So how is it, and it's not that I'm looking for anybody to die. Right. But the consistency is we don't have a trust in this system because we have reasons not to have a trust in this system.
We're dismissed way too often.
And not only that, but in nursing school, this is going to sound crazy, but in nursing school, if ever the answer was African Americans is at a higher rate,
wow,
I always knew to choose that answer.
Wow.
Because no matter what we talking about, African Americans, African Americans, and it's like,
wow. Right.
So what are we going to do about that? Because that in these history books that y'all have continuously been teaching is what you get to continuously teach about.
Right.
Is that African Americans are at a higher rate all the time. Mm-hmm. And in class, I'm like, yeah, we know. And everybody's like, mm-hmm. So, cultural healthcare. You know what I mean? That's mm-hmm. my thing. It's like, mm-hmm. now we, why don't we just change the narrative?
Absolutely.
You know what I mean? Because
mm-hmm.
nothing is going to change about this unless we change it. Mm-hmm. You know what I mean? Because
mm-hmm.
the biggest thing is either we change it or we keep complaining about it.
Absolutely.
You know what I mean?
Absolutely.
And it's like, can you imagine your child wanting to be the next doctor and then having to walk in with the challenges after he's already mm-hmm. went through school mm-hmm. and struggled the way that we struggled through nursing school for all of those years, only to come in to be treated like nothing. Mm-hmm. We got to change the narrative. So, Women's Maternal Week. When do you guys have that? Is that typically? I think I read it was April. Is that right?
Yeah, there's a couple of different weeks. I believe so. Yeah.
So, what happens during that time?
So typically there are different organizations will do different things. So I know, is it Cradle Cincinnati locally has like a week of events where they'll do like different virtual like Zooms, and sometimes they'll have like in-person things. So yeah, it's just stuff kind of all over the place. There's no like generalized like, Black Friend Reunion or anything like that.
Okay.
But just kind of like sporadic things that you'll see like on social media and stuff like that.
So honestly, now that I'm really thinking about this, I would like to see something different because I feel like we have either certain months for something to do some education, but I don't think like these little bitty periods mm-hmm. do enough. Mm-hmm. That's almost like Black History Month, it being, 1 month out of the year. Mm-hmm. We should be learning Black history all year, right? Yeah. So if we put something into the media to where we can continuously teach our women, mm-hmm. Our African American, just more education than that one little period where it's like, oh, we're talking about it this week, and then we got a whole another 51 weeks out of the month where that week they came to win. You know what I mean? And that is what keeps bringing us back to that 1 week where it's not feeding us enough. You know, it's like you go to church on Sunday, you got to go back on Sunday to keep getting your cup refilled. You know what I mean?
Right.
So we just have to, I don't know, I'm just thinking like we need to do something to where we can better educate ourselves and better educate our people. You know what I mean? Because our objective is a better community for us, right? You know, so kosher healthcare is so necessary. Now, why do you think kosher healthcare is necessary?
Well, I mean, I definitely just feel like from the way you explained it, as far as having providers where the providers look like the population that they serve. I mean, statistics show that patients have better outcomes when their providers look like them. I mean, I saw statistic after statistic, that I saw of that when I was in school, that said, similar data. So, I mean, and like patients trust better when their provider looks like them. I feel like providers, like me personally, I'm gonna go hard for all of my patients.
Absolutely.
Right? But I don't know. I feel like, so like, for example, I had a patient, and I probably will never forget this couple. So I had a patient that had come in. This was still when I was at the bedside. This was before I had passed my boards. I might have passed my boards, but I was still at the bedside. But anyway, mom was admitted with, she was like threatening a miscarriage. Preterm labor was what she was admitted with. And so we were trying to stop her labor, and she was doing well, and they were talking about discharging her because she was doing well. And then out of nowhere, she started to dilate again, but she was too early. There was nothing that could be done to stop her labor. And, she wound up, of course, they wound up losing the baby. But it broke my heart because I didn't want them to feel like they were just another statistic. They were African American. And so I didn't want them to feel like, and I'm like literally like racking my brain. Like, I mean, I literally like went in the break room and like bawled my eyes out. Because I didn't want them to feel like we're just another black couple with just another black baby that nobody cares about. And so, I mean, literally like I racked my brain and I'm like, we did everything right. Like, it was just one of those things that, just happened. But
how do you explain that when it's just out there and like, because who are you gonna believe the statistics and everything that's out there, or
but because we are so overlooked and dismissed, we need people out there that are looking out for us. And that, that are going to make sure that we're good. And I mean, even like as a midwife, like I saw a patient, she came in, I don't even remember what she came in complaining of. Maybe pelvic pain or something. I don't know. But anyway, like she had gone, like her mom had taken her back and forth to the ER a bunch of times and they felt dismissed. She's like, I feel dismissed. I feel like nobody's paying attention. And I was like, I got you.
I know that's right.
I got you. We're going to do a pelvic ultrasound. We're going to do this. We're going to do that. We're going to try to get to the root of it. I got you. I'm listening. I'm not going to dismiss you. But we need us. We need us because how else are patients for so long, historically and in present tense, we've been mistreated. Our people have been mistreated by the healthcare system. And so how else are people going to learn to trust the healthcare system if they don't see providers that look like us? And I'm gonna be honest, like it's not even just us, but it's other minorities.
It is.
You know what I mean? Like it's not just African American people. It's Hispanic people. It's 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 lower income
Yeah.
Caucasian people. Like, it's just, the system is just messed up.
It is, and that's why I said this is made to include everybody. But speaking like when we speak, I can speak as an African American female, right?
Absolutely.
So that's why I'm like, I always make sure that in these interviews that I'm saying, like, it's inclusion. But I gotta speak from the African American. Now I can see what they're doing to you too, and I stand up for you too.
Mm-hmm.
You know what I mean? But speaking from how I'm being treated,
right.
I'm the nurse and I'm getting treated by the people that I'm working for, and then I gotta fight for me and my job, and I'm here fighting for you.
Yeah.
You know what I mean? Like, so together we kind of losing.
Right.
You know what I mean? But speaking of that, I was when I did the mother baby thing, because you do have certain stories that you'll never forget. There was a girl there that had her 7th baby. And that's the thing, it's a statistic, because African American women, we had the most babies or whatever. Shout out to God. But shout out to God, because I have 6 and I'm so grateful for it. I thank you.
Yeah.
But on the day she gave birth to the baby, she just kept having a headache that was just so bad she couldn't get up. So the baby had to like basically keep going back and forth to the NICU. And I kept looking at her and I'm like, something's not right. So I called the doctor in, the doctor come, and I'm like, I think we need to do something. Now, I think I had this lady 3 days in a row, because it wasn't until the 3rd day that I was like, I'm about to lose my job. Because what's not about to happen is you're not gonna not do anything for her in front of me.
Right.
And you're the same person who keeps on being on, you just keep on brushing it off. Now, time matters.
Right.
Do you know what I mean? So I'm like, they ended up doing, I believe they did like a spinal tap or whatever. And that's what was needed. Yeah. But on the first day, I was like, I think we need to, and it's like, no, and I'm like, no, she can't even sit up. Like, she's like, my head is so, you know what I mean? So she had to keep laying down. Yeah. And I'm just like, I think she knew it, because by the time I had got to that day, I'm like, I'm about to lose my job. I am. Like, and I don't even know you.
Right.
You know what I mean? But I'm about to lose my job, because I shouldn't have to fight this hard.
Exactly. Knowing
that if you were a different color, all the tests would have been ran. Do you know what I mean? Like, so it's just, it's that. Yeah. It's the going home knowing that I did everything that I need to do for you. Because even though I'm probably about to have to hear the manager mouth for me having to communicate with this doctor, that's fine.
Right.
You're fine. And you get to go home to your kids.
Right.
You know what I mean?
Right.
But it's like, has something bad happened to you,
absolutely,
then I wouldn't have been able to live with myself. You know what I mean? And that, when you give that oath to be a nurse, I feel like that's what it should look like.
Absolutely.
You know what I mean? Like, I don't just come here for the paycheck, because it's like the paycheck ain't paychecking.
Right.
You see what I'm saying? It's not doing what it is, so it's not the money.
Right.
You know what I mean? So I obviously have to have a passion for being here. And once again, it is not just about the African American patients, because I love my white patients, my Hispanic patients, the ones that don't speak at all, the silent ones. You know what I mean? You know what I mean? The ones sleep, the ones woke. I care about every single last one. So I make sure that you get everybody gets the best need. Exactly. But the system don't care that I'm coming in here giving my all in all, because you got a complaint about me not doing a reassessment on the pain. Like, give me some help. Right? Provide me with the staff that I need, because I'm always short. So provide me with the staff that's needed to be able to be the extra me that I can give. You know what I'm saying? So, but it's sad to say that a lot of times, but that when you're taking care of a Caucasian patient, unless it's something that's really critical, they're going to be fine. Because if I send a message to the doctor telling you, because you're going to look at the demographics and everything, if I send a message to you, I know that you're going to give me what I need for them. But then when it comes to my African American patient, I've had to fight way too many times when the treatment is supposed to look the same. And this one don't even need the medicine. For real. They don't even need it. But pain is what the patient says it is, so I let that be, unless the numbers don't look right, then I gotta tell them, like, it's my license on the line. Right. Your blood pressure is way too low. Right. Not doing that. Right. You know what I mean? Right. But to my African American patients, I had to, why? Can you call me? Can we talk about this? Why do I have to fight that hard? Right. For treatment, and you don't even give me reasons just because you don't have to, but you're taking their insurance. Yeah. You know what I mean? Like, you sending them out and they're coming right back in for the same thing. Well, we could have just fixed it when it was here.
Mm-hmm.
You know what I mean? So it's just way too much of that.
Yeah.
And I just, for me, this fight is so much bigger than me because it's for the nurses that are silent.
Mm-hmm.
You know what I mean? It's for the people that suffer. They got to go sit in their car for a while or got to go take a lap around the block because, you know, we don't know what to do. We shouldn't be placed in these positions.
Yes.
You know, to have to be here at the cultured experience.
Yes.
But since we are here, we're going to talk about it.
Absolutely.
We're going to talk about it, and this is going to be a worldwide thing. We're going to talk about these experiences because this is what's going to make the world better.
Yeah.
For all of us.
Absolutely.
Not just one group.
Mm-hmm.
You know, so it's exhausting, and we got a long way to go, but I'm ready to take this walk. You know what I mean? I'm ready to be the change that we need because we need to be heard. We're already present. You know what I mean? We need to be heard.
Mm-hmm.
Like, that's the thing. We need to be heard in this field.
Yeah.
You know, so is there anything else that you'd like to share with, you know, as far as the mom, baby, the nurse practitioner? Are you accepting patients?
I am currently looking for experience.
Okay.
So, you know.
Okay.
OB and gynecology experience.
Okay.
So, yes.
Okay. Well, hey, the people that hear
in Cincinnati.
in
Cincinnati, Dayton
come on,
area.
Cincinnati. If y'all looking for an amazing nurse that's gonna take care of your patients, that's gonna bring the patients in, you need to look to Deana.
Yes.
You know what I mean? You need to look to Deana.
Yes.
Well, I really appreciate you even walking this journey. I appreciate
Thank
you even giving some of your experiences. And, you know, this right here is the start of something historic. You know what I mean?
Yes.
It's the start of something historic because we're going to create a better tomorrow for our kids.
Absolutely.
For everybody else's kids.
Yes.
You know what I mean? Because I don't want them to be having
Right.
to sit here talking about this.
Yes.
You know, so thank you for being at the Cultured Experience.
Thank you for having me.
And keep in mind that it can't just be me. It can't just be me. We gotta talk about it. We gotta get it out there. Y'all looking for a new hospital? Y'all looking for new opportunities? Come on to the Cultured Experience and let's talk about it.
Yes.
Thank you for being here with me.
Thank
Absolutely.
Shout out to Horizons Women's Healthcare and Dr. Andre Harris.
Yes, absolutely. Yes. Thank you so much. And they'll come in and they'll line up all the directors who do all the hiring. They all look the same. They all look the same. It's all white women. So I'm just sitting here looking at this, like, because I can't not look at it. And they'll bring the one token black girl that is just a nurse, but she like won a Daisy Award. So it's like, this is our contribution to y'all. The same person, and it's like, I know what y'all doing. It's crazy. Like, how do we motivate them to know that you can? But then why should these barriers be up when you gotta work like 10 times harder? Like, I've had to bust my ass for everything that I got, and you mean to tell me that, like, and there's nothing wrong with being a bedside nurse. I loved it.
But it's more.
It's so much more. Like, we need to be making decisions because you see
what
what I'm saying? And it's like, why do I gotta fight this hard? Like, I have a master's degree, I have a bachelor's degree, I have 2 associate degrees. I'm about to be a nurse practitioner myself.
Yeah.
What?
Yeah.
What else do I gotta do to prove that I'm very capable in making decisions? So you know what? It's like, you know what? Make my decisions. I'll create the opportunities for those that you won't create the positions for. And then you won't have the power. We'll just have our own. And then we don't have to have so many black babies dying. They don't have to be the narrative.
Right.
You know what I mean?
Right.
We will have more black women that are taught to breastfeed. And then we don't have to worry about that being a narrative. And then, you know, next year the statistics will have went all the way down.
Right.
Like, but things have to change in order for that to change.
Yeah.
Like, I'm just so sick of and so fed up of this system that I can't even see straight.
Yeah.
So I've literally committed my life to this.
Yeah.
Like,
I love it.
People are like, you want to do a contract? No, I don't. I want to do exactly what I'm doing because I know exactly what I'm doing. If I keep on working at this every single day, it's going to give what it is that we need.
Yeah.
You know, this is so much bigger than me. It's like when I see what you're doing, and I'm just like, I know you're capable because I've seen your work.
Yeah.
You know what I mean? I know you're an awesome nurse. You know what I mean? But I know that you're probably dealing with something that I've already dealt with, or you know, your own struggles that you shouldn't even have to struggle with, just because I'm capable. You know, so like I said, it's an everyday mission for me. Every day that I get up, every day that I wake up, I'm thinking about something different, something new that I can put out there, some other kind of way to gain some ears and some eyes for people to understand that, like, I hear them silent cries. I know what you're going through. Like, when I'm looking at the only black girl that's in nursing school, I'm like, oh, I was her. Like, I was there. And I would come home and, you know, complain to my husband and talk about it, and it's like every day just felt like it was just not gonna end until it did, and then it was a new challenge. It's like, this don't stop. You know, it doesn't stop. So I'm just like, you know what? I hear you, God. I know what you want me to do, because you know I ain't quiet. Right. You know, because why should I have to be? Why should I have to be quiet? Like, y'all out here killing us. Right. You want me to be quiet? Right. Like, well, now what if that was one of mine? Then I gotta be a whole nother me. Right. So it's like, let me save the world from this whole other me by saving the world. So that's what we're doing. So it really is a passion. Awesome. It really is a passion just to create something different. Like these staffing ratios. Like, I done had as many as 7 patients before. That's heavy. And I work the night shift. My circadian clock telling me I'm supposed to be asleep, but I'm running around like a Hebrew slave. Right. Like, I'm running around here like, you don't care. Because you at home sleep. Right. But your family. Right. You know, so it's like, I hear all of us, like all nurses. Like, did you hear about that Tristan K. Smith? I shared her on the page, the 28-year-old that killed herself August the 7th. Wow. And she wrote a letter. She had a suicide note that was addressed to the hospital, the healthcare system. Wow. Yeah, it said something like a letter to my abuser, you know, and it talked about the healthcare system like failing us, like they don't, you know, you truly don't care. It's like, now I got people out here committing suicide. Right. Oh no, like I wish I could have saved her. I really wish that I could have created this, and that she could have just saw it to say, you know what, let me get with that, because now I know that, like, we're in it for us, like we're fighting together for us. But like I feel so bad because it's so close, you know, not because it's so close, but you know what I'm saying, she's in Dayton. Wow. It's like, I'm killing myself with the healthcare system, the people that are supposed to heal me and help me, like, make it make sense. So yeah, we got a long way to go, but you know what, I'm ready. Like, I'm getting my armor on right now. I'm ready for this. I'm ready for this. I love it. Yes, we need it. We need it, so we're gonna see some change. Culture healthcare gonna be everywhere. HBCU, here we come. Absolutely. Here we come. Here we come. Everybody gonna work with us. So I had to get that out, because I like, this is how exhausted I am just thinking about it. And I eat, sleep, and breathe this, because I just don't want these to be our conversations no more. But since it is, you know, let's talk about it. Gotta talk about it.
I'm excited.
Yeah, I am too. We got a lot of people that's on board. So that's why I'm just like, you know, just keep pushing. And just keep on pushing. So I'm pushing. Yeah.
You definitely are doing the daggone thing. And you're even like motivating and inspiring me. You know, this conversation is definitely
you can do. You know,
needed.
You know what? You also have to keep in mind that God puts you where you're supposed to be, right when you're supposed to be there. And a lot of times it don't. So I'll tell you. What was I guess the catfish in my water to get me going was I had experienced racial discrimination. You know, just working on the floor from a director that didn't know me. You know, all she saw was this black girl sitting here at this computer, and knew that she wanted this black girl gone. Right? Wow. And I had a good rapport where I was working at. I was cool with the manager until I reported to the director, and nothing got done about it. You know. To make a long story short, after being verified multiple times, she wanted to be escorted off the unit because I didn't want to talk to her, because her energy, when she brought the energy to me, it was already bad. And I could just tell, you know, from your energy that all I told her was, you know, I don't feel comfortable talking to you. And it became a big thing to where she's like, I want security to escort her off of the premises. The person that was around was just like, oh, I gotta deal with this, but you know, if anything comes from this, you know, I got floors, you know, you can bring your students there, but it's like, we're not gonna address the fact that so for me, that was a catalyst. So, I ended up having my first medication error. I never had one, but the anxiety from being at work, like, I'm like, I know I'm about to be retaliated against, and they did exactly what I thought they were gonna do. They used my situations against me to get me out the door. Which was fine because I already knew this place didn't know that another one of their facilities tried to get me out the door for reporting one of their nurses before. So, you know, surprise, surprise. They didn't even know that. Yeah. But, you know, you were too comfortable. And you're made to be too comfortable because nobody's going to say anything to you for even, you know, coming at me the way that you even came at me. So that's why I was like, you know what? I'm sure other people are experiencing this. You know, that is just a waste of resources. Like, you're a waste of a resource if you can just come in here and treat the people that's actually doing the work like this. I done committed 3 nights a week to y'all. I teach during the day for y'all on your unit. So I spend more time here than I do with my own family. For you to feel comfortable and thinking that you're going to treat me any kind of way when I commit so much of my time to y'all is ridiculous. But that day, I was having anxiety. I told my husband, I said, I'm gonna have to call off today because my anxiety is just so high. And then that night, later that afternoon, I found out that they didn't want me there, and they was doing everything to push to get me out the door. But you can push to get me out the door so that you don't have to address that email that I sent. Right? This is the second time that y'all done did that to me. It is crazy, but you know what? God does everything that He does for a reason. So I say you are where you're supposed to be, because while the whole time I'm crying and I'm angry and I'm upset and I'm feeling defeated. Like, once I gather myself together, I said, okay, we're going to do something with this. We're going to have to take this and we're going to have to do something with it because we have to stop these from being people's experiences. Like, if you feel that way, don't show up for work. You have to see Black patients. You have to see Black nurses. You have to see Black doctors. You have to see people of color. And if that's the case, like, how y'all treat these patients? Right? That's my thing. Like, I can come in and treat all my patients with respect. I don't instantly come in and look at you as a white person and be like, you know, I want to, like, nah. It's once I introduce myself to you, then I see how you respond to me that lets me know how I need to deal with you. So, you know, that, I say all that to say you are where you're supposed to be, and you never know what kind of opportunities are going to open up for you. So it's kind of like you just kind of got to stay the course. Like, there's something in this period of your life that you're supposed to be getting right now. Like, even when I don't get it, and then boom, God, I got it. I understand now. So you where you supposed to be at. Like, you just be patient. You just be patient and just hang on, because it's something better coming for you. Like, these better days are coming. Okay? Thank you. Yeah, absolutely.